Thank you. Thank you very much for the invitation. Although, as you said, Matthias, this is going to be a tough afternoon for me because we're looking at ugly images from radiology, and I'm somehow the bad guy in here. But maybe taking one step back from at what we've looked now, all the possibilities with the carbon implants. Actually, the routine case in daily clinics is titanium implants. And what are those possibilities that we have right now to decrease the metal artifacts that we get from those metals? And we're going to talk about how they are caused in CT and in MR and what we can do about them, which is a pretty ambitious thing in 15 minutes. But let's go ahead. We've seen this already. I think nowadays there's hardly any part in the body where we do not put a metal in, or at least orthopedic and trauma surgeons do. And it's not only the big three like hip implants, shoulder implants, or knee implants that you use. You're actually putting them anywhere to any part of the body. So metal artifact really is an issue in daily radiology, routine and radio-oncology. So I want to talk about metal artifacts in CT, how they are generated, what can we do about them, are there any metal artifact reduction strategies in CT so far, and the same thing applies to MR, how are usually those artifacts generated, and what can we do about them, and maybe what is the way to go from now. Maybe it does not really lie in those technical issues, it's much more on new trends in the materials that we use. This is just one busy slide. I will not go through all of those problems, but actually it's just a summary of the things that we may encounter as radiologists when we look at implants. It's a huge basket of things that we can see, ranging from aseptic loosening to hematomas or inflammation of the surrounding tissues, and all those things have to do with artifacts that may disguise them and make it difficult for us to detect them on the images. So, as I told, let's take a step back and try to make it very basic. This is biological orange from Sicily, which I prepared with a small copper coin right in the center, and I also inserted 2 steel screws in orthogonal direction, one to each other. And then we reassembled the orange and put it through the CT scanner just to give you an idea of how those artifacts are generated and what kind of factors are coming into play. So you see, we used a CT energy of 80 kilovoltage with 20 milliamperes. You see that we have a rather small artifacts from that copper coin, but rather severe artifacts from that screw. And you can also see that the artifacts pretty much depend on the orientation of the metal towards the gantry rotation, and also the geometry of the metal has a quite severe influence on the kind of artifacts that we get. If we then increase the tube voltage from the gantry, from the energy spectrum that we use, you can see that by increasing the tube voltage, we can nicely decrease those artifacts that we get from the screws and from the copper coin. We can also increase the tube current, but obviously the decrease in artifacts is not that much as we may get from increasing the tube voltage. If we change the window settings of the images that we look at and we use soft tissue reconstructions, you can see that we have a nice delineation of the orange flesh itself. However, we get a very smeared image appearance with very strong artifacts in the image itself. And then we can also play with the slice thickness that we look at. If you take small image slices, we have far more image noise in the images than when compared to a standard 3 or 5 millimeter reconstruction. So we do have many factors affecting the artifact amount, not only the metal itself, be it copper or titanium or carbon or whatever, be it the geometry of the metal, but also on the acquisition side from tube voltage, tube current, and the reconstruction side from slice thickness and from kernel. So what can we do maybe about it to decrease those artifacts? And I just want to present you one concept that is quite broadly used these days. It's the dual energy CT concept, and I also want to make you acquainted with reconstruction algorithms, iterative reconstruction algorithms that may reduce those artifacts. So what is dual energy? Dual energy is actually a CT scan that we acquire from the material with 2 different energies at the same time. And you can see soft tissue follows a certain path, a certain slope of attenuation with increasing density of the material. However, that slope is quite different for different material like bone or iodine. And if we then use that dual energy information from the two spectra that we have, we can play with the attenuation curve of different voxels. And this is actually how it is acquired. We have two tubes, two gantries rotating around the object at the same time. There's different scanners using different setups with dual layer scanners. There's others which switch the kV very fast while rotating around the object. And there's other designs where we have a dual scan just doing the scan twice. And this is what comes out. You have the 80 kV image, you have the tin filtered 150 kV, and obviously there's not much a difference if you just look at them at the image themselves. You have the atherosclerotic calcification, and you also have a faint calcification here around the soft tissues close to the radius. If we then do the material decomposition, as I've shown you from the dual energy data, we can then highlight those calcifications due to their different biological nature. And we can see, okay, those calcifications, they are not calcium as we see in the arteries. They are actually gout tophi that we find in a patient with gouty arthritis. This is the principle of material decomposition with dual energy CT, and it's actually the same principle that we use for generating those monoenergetic extrapolations which we use for decreasing artifacts in CT. Again, this is how it works. An 80 kV image, you see those severe streak artifacts from the screw. You see that those artifacts are getting less if we increase the tube voltage, as I've shown you with the orange. And if we then decompose the volume with that material decomposition algorithm and generate those artificial monoenergetic extrapolations, you can see that by increasing the monoenergy, we get a decrease in those artifacts up to, for example, 170 kilo electron volts, where we have a nice decrease of those streak artifacts compared to, for example, to 80 kV. This is actually something we can do on a routine base. Any institution that offers a dual energy CT scanner can do those kinds of things. And this is one example from our clinical routine. You see in the single energy acquisition, there's marked streak artifacts around the vertebra. You can see that with the bone reconstruction, we have somehow a sharper image, but again, those streaks are very, very sharp and very accentuated. And if we then use the monoenergetic extrapolation, we can see that osteolytic, small changes around the screw, which we could not see on the single energy images. We've looked at various implants at various body regions from all our patient data, and we could see more or less the same thing. Using monoenergetic extrapolation decreases the kind of artifacts significantly throughout the body region. This was one thing from the acquisition side, dual energy CT, but there's actually another advance in reducing artifacts in CT images, which comes from the reconstruction side. And I will not go into detail of that graph. I just want to show you that it's all about that loop, an iterative reconstruction loop. That's actually a mathematical process which tries to reconstruct the image only with a certain amount of data that's coming in, and tries to interpolate and get normalized data from a pre-data set to generate images that are fairly devoid of artifacts. There's actually different solutions from different vendors. Siemens House in here, but all those big vendors have actually come up with those iterative reconstruction algorithms. And this is an image from daily routine that shows you how this works. You can see the uncorrected single energy 120 kV image. We have severe artifacts throughout the pelvis, and even if we take the bone image window, we still have to deal with strong artifacts down in the pelvis. However, if we do those iterative reconstructions, you can see how those severe streaks diminish, how we can nicely delineate the pelvic contour, also look at those soft tissue organs down in the pelvic floor, and we can see small cracks around the acetabulum, for example, which we would not have seen in the single energy images. And we can also produce those volume-rendered tomography images devoid of any artifacts, which nicely show the delineation of the implants and the surrounding bone. There's also another concept that maybe surgeons deal with. It's the flat panel CT. It's actually using detectors with highly oriented scintillator crystals, making highly resolution images, and those detectors are mounted usually like flat panels on those C-arms that can rotate patients in any arbitrary directions. And with these C-arm flat panel CT images, these days we can also produce nice CT images, and there's also iterative reconstruction algorithm software at hand to help you decrease those artifacts that you might get, for example, from small screws of the scaphoid bone. And you see that if you correct those images from the uncorrected version, you have a nice delineation of the screws and also of the fracture line, which you can also measure and see that there's really a significant change in the attenuation of those artifacts. So, having talked about CT, let's just have a quick look at MR, and I told you it's going to be a tough ride in 15 minutes going through all those artifacts in CT and MR. But MR is a different story. MR, we're dealing with B0, like the magnetic field inhomogeneities, and these inhomogeneities actually are caused by different metal implants in the volume that we look at. You see there's diamagnetic substances like human tissue, water, copper, nitrogen, and they do not really change the magnetic field. We have a really nice alienation of those magnetic field. However, if we introduce paramagnetic substances such as iron or gadolinium or magnesium in that magnetic field, we get a distortion of those lines. And by distorting those lines, we also lose the information on the location of the signal that we look at. If we look at ferromagnetic substances, again, iron or cobalt and even nickel, we get an even stronger distortion of those lines, and this is why we end up with quite severe artifacts. And those image artifacts are usually signal loss, geometric distortion, or inhomogeneous fat suppression. And this effect is actually dependent on the kind of MR sequence that we look at, which is something that I've talked to you earlier. It very much depends if we look at simple spin echo sequences, or if we look at fast gradient echo images, or if we look at diffusion weighted images where we try to see what is the tumor really looking, what is the tumor doing. So it's depending on the kind of sequence that we acquire. This is another example. It's not only depending on the material that we use, for example, titanium rods or iron rods. It's also dependent on the orientation that those rods have compared to the B0 field. For example, if you have the screws oriented in an orthogonal direction, you have more severe artifacts as if when you have them orientated parallel to the magnetic field. So material, geometry, and the orientation to the B0 field and the sequences themselves, they all come into play when we talk about artifacts in MR imaging. But there's also a bunch of solutions at hand for decreasing those artifacts. Of course, we don't have time to go into detail for all of them, but just to show you, this is just simple standard images from those spinal implants. You see a T2-weighted fat-saturated sequence, which is more or less the same as a stir sequence, but with a stir fat suppression, we get a nicer homogeneous fat contrast around those spondylodetic images than just with the T2 fat set images. And if we then do warp sequences, which are artifact reducing sequences in MR, we get a nicer delineation of those borders from the bone. We also see light bony changes with increasing water around the implant, and we do have a nicer idea of what is going on in the bone adjacent to the implant. Another example, these are just standard stir images from a radius head implant, and you can see with the warp artifact suppressed images that there is some amount of fluid around the prosthesis itself, and also we can see the ligaments between the humerus and the ulna quite nicely with those artifact suppressed images. One case from our daily clinic, we also took a warp sequence. In that case, you can see the liquid around the femoral rod, and we also did a Moab scintigraphy to look if there's any leukocytes going into that cavity, and this was then diagnosed as an infected femoral nail. And just a last slide from some experiments that we have done in the last few weeks. We actually took a sheep spine and we implanted in that sheep spine, cadaveric sheep spine, spondylodetic material made of titanium, and on the other hand from carbon. And you can see that there's quite severe artifacts in the standard acquisition from a stir image. We use different kinds of artifact suppression techniques. Maybe warp would be the most up-to-date sequence. And you can see that we still have to deal with quite a fair amount of artifacts, although that penumbra, that aura around the screws gets less. Also with the carbon implants, and those were actually carbon implants with a small titanium coating. They were not mere carbon implants. Also these implants did show some artifacts which could be reduced to some extent with those warp techniques. But again, there's still some amount of artifacts that we are still dealing with. So we've seen it already. Maybe the true next step will not come from technical advances. It will maybe more come from the material science, and maybe we're going to deal with new materials that are inert to those artifacts, like carbon plates or carbon rods at the lower extremities. This is one CT example from our daily routine. We've seen some of them already, showing again those carbon screws devoid of artifacts around their heads. You can also see that those coated screws do not cause that much of artifacts, and just from CT we have a very nice idea of the spinal canal, of the pedicles, and what is going on around those screws. So, summarizing of what I've tried to show you briefly, we have to deal with artifacts in CT and MR from metal implants. There are different physical effects coming into play. B0 inhomogeneity is the major problem in the MR images, but we do have some solutions at hand. We do the dual energy CT, the iterative reconstruction, or the flat panel iterative reconstruction in CT, and we have variable solutions also for MR imaging, but maybe the real true next step will come from new materials, for example, carbon. Thank you very much for your attention.